Hello friends, this is Gita Sahu, Department of Pharmacy. Today is 17th May. You know that 17th May we are celebrating as a World Hypertension Day. So today we are discuss about hypertension. So let's begin. Hypertension. Hypertension is cardiovascular disease, most leading causes of death worldwide. Cardiovascular disease count for over 17.5 million deaths in 2012. Most cardiovascular disease are preventable. Definition of cardiovascular disease. Cardiovascular disease are the disease of the heart, vascular supply of brain, and disease of the blood vessel. Types of cardiovascular disease: coronary heart disease, stroke, hypertension, rheumatic heart disease, cardiomyopathy, myocarditis, and other. Hypertension. WHO facts it for hypertension. Globally, nearly a million people have high blood pressure. Of this, two-thirds are in developing country. Hypertension, one of the most important causes of premature death worldwide, and the problem is growing. In 2025, an estimated 1.56 billion adults will be living with hypertension. Changing trends of hypertension. They contribute by hypertension, heart disease in 1990 0.34, 1995 0.38, 2000 0.39, 2005 0.45, 2010 0.54, and 2016 0.64. So it's gradually increased. According to WHO, hypertension, also known as the high and rise blood pressure, is a condition in which the blood vessels have persistently raised pressure. Hypertension classification in adults. According to WHO, BP category means blood pressure category, stroke, systolic and diastolic blood pressure. Systolic pressure in the blood pressure when the heart beats, and diastolic blood pressure when the heart is at rest. When blood pressure is measured, the systolic pressure is recorded first and then diastolic pressure. Blood pressure is measured in millimeters of mercury, mmHg. For example, if systolic pressure is 120 mmHg and diastolic pressure is 80, it is written in 120 by 80 mmHg. Hypertension to the high risk of heart disease. Regular checking of blood pressure and treating hypertension as soon as it is diagnosed can avoid serious complication. Normal blood pressure category is less than 120 mmHg systolic blood pressure and less than 80 mmHg diastolic blood pressure. In case of elevated blood pressure, 120 to 139 mmHg and less than 80 mmHg diastolic blood pressure. Hypertension stage 1 in diastolic blood pressure is 80 to 89 mmHg and systolic blood pressure is 140 to 159 mmHg. In case of hypertension stage 2, greater than and equal to 160 mmHg systolic blood pressure and greater than and equal to 90 mmHg diastolic blood pressure. Then we are discussing the pathology of hypertension. Two main pathology of blood pressure and hypertension. First, cardiac output, and second, peripheral resistance. Cardiac output, when NaCl and other electrolyte increasing, then stroke volume, heart rate is also increased, so leads to hypertension. And second, peripheral resistant, it causes vascular structure and vascular function, then causes hypertension. Causes of hypertension, two types: primary hypertension and secondary hypertension. 94% of cases is primary hypertension and 6% of case is secondary hypertension. Secondary hypertension is causes mainly renal failure, endocrine system failure, and others. Risk of hypertension. modifiable and modifiable, just obesity, salt intake, saturated fat, dietary fiber, alcohol consumption, and physical activity and environmental stress, socio-economic state, and risk factor is non-modifiable जैसे age, sex, ethnicity, and genetic. Clinical features of hypertension. Hypertension is regarded as silent killer. Without sign and symptom, it can cause nose bleeding, early morning headache, and irregular heartbeat, buzzing in ear. हाइपरटेंशन को साइलेंट किलर भी कहा जाता है क्योंकि ये कभी कभी बिना साइन और सिम्टम के भी होता है. सीवियर हाइपरटेंशन is tiredness, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. Prevention of hypertension. Primary prevention, population strategy, and high risk strategy. And secondary prevention is earliest case of detection and treatment and patient complaints. Population strategy is nutrition and self care, weight reduction, exercise promotion, behavioral changes, and health education. Days diet means D for dietary, A for approach to, and S to stop, H for hypertension. Hypertension को stop करने के लिए डेज डाइट लिया जाता है. 50-100 mg per day salt. Physical activity. According to WHO, some recognized physical activity for health. According to age, it's classified 5 to 17 year. Activity is classified moderate and vigorous intensity. Time 16 minutes per day. Age 18 to 64 year. Moderate intensity, vigorous intensity, and for time 150 minutes per week and 75 minutes per week. Greater than and equal to 65 year means senior citizen, moderate intensity and moderate plus vigorous intensity. For time for this is 150 minutes per week and 75 minutes per week. Lifestyle modification to manage the hypertension. Most of the hypertension is causes for the lifestyle, जैसे alcohol consumption और high diet, high fat consumption, etc. So lifestyle modification is to manage of hypertension. Modification just weight reduction, dash diet, dietary sodium reduction, physical activity, and moderate alcohol consumption. Recommendation किया है weight reduction के लिए according to BMI index. डेज डाइट हाई फाइबर डाइट लेने के लिए, डाइटरी सोडियम रिडक्शन के लिए लेस देन 6 ग्राम पर डे, और फिजिकल एक्टिविटी एटलीस्ट फॉर 30 मिनट पर डे, और एल्कोहल कंजप्शन के लिए लेस देन 2 ड्रिंक पर डे, लेस देन 60 ml इथेनॉल. अप्रॉक्सीमेटली सिस्टोलिक ब्लड प्रेशर 5 to 20 mmHg. वेट रिडक्शन करने से अप्रॉक्सीमेटली जो सिस्टोलिक ब्लड प्रेशर होता है वो 5 to 20 mmHg मॉडिफाइड हो सकता है. डेज डाइट से 8 से 14 mmHg तक मैनेज हो सकता है. डाइटरी सोडियम रिडक्शन से 2 से 8 mmHg तक मैनेज हो सकता है. फिजिकल एक्टिविटी से 4 to 9 mmHg तक, एंड मॉडरेट एल्कोहल कंजप्शन से 2 to 4 mmHg तक, if recommendation of WHO is followed. हाई रिस्क स्ट्रेटेजी क्या होता है? टू प्रिवेंट द अल्टीमेट ऑफ लेवल ऑफ ब्लड प्रेशर एट विच द इंस्टीट्यूशन ऑफ ट्रीटमेंट वुड बी कंसिडर्ड. सेकेंडरी प्रिवेंशन, अर्ली केस ऑफ डिटेक्शन. अगर शुरुआत में ही साइन एंड सिम्टम को समझकर उनका डायग्नोस किया जाए और उनका ट्रीटमेंट किया जाए तो हाइपरटेंशन का ट्रीटमेंट पॉसिबल है. स्क्रीनिंग, नॉन फॉलोअप, हेल्थ चेकअप एट एवरी कॉन्टेक्ट विद द हेल्थ सर्वे. सेकेंडरी प्रिवेंशन मीन्स अगर आपको हाइपरटेंशन डायग्नोस्ड हो चुका है तो आप उसका ट्रीटमेंट ले सकते हैं. जैसे कॉजेस सेकेंडरी हाइपरटेंशन और प्राइमरी हाइपरटेंशन में मेन डिफरेंस होता है कि सेकेंडरी हाइपरटेंशन के कॉजेस जो होते हैं वो अननोन होते हैं. और ऐसे में उनका ट्रीटमेंट जो लेस देन 140 और बाय 90 mmHg ब्लड प्रेशर की कंडीशन में मैनेज कर सकते हैं। सेकेंडरी प्रिवेंशन में पेशेंट का कंप्लेंस जो होता है वो टू एक्सटेंड टू विच पेशेंट बिहेवियर coincide with clinical prescription. So last, World Hypertension Day. World Hypertension Day is celebrated on 17th May